going to discuss a topic which worries lots of parents: nephrotic syndrome or protein leakage in the urine.
Nephrotic syndrome is a disease affecting our kidneys, and in the most simple language, there is a loss of protein in the urine that is at the base of this disease.
So why does protein leak in the urine in this condition?
To be very honest with you, there's been a lot of research going on this since the last 30 years or more. They cannot pinpoint one particular reason for it.
The nephrotic syndrome is diagnosed. The first line of treatment is, of course, steroids.
So, steroids are the mainstay of treatment of nephrotic syndrome. So, one word that I would definitely tell the parents.
Namaste everyone, welcome to one more episode of podcast with me. I am Dr. Amitabh Kulkarni, consultant nephrologist. This is a platform where we try to break down healthcare in simple language, honest language, and without any unnecessary jargons. We speak with different doctors, try to understand the latest information in the field, and we'll try to share the information that will benefit both doctor as well as patients. Today I am going to discuss a topic which worries lots of parents: nephrotic syndrome or protein leakage in the urine. Now many a times the worry is due to lack of knowledge. Many a times patients are not fully aware about the conditions. They may feel that the kidneys are failing. They don't know how to identify early sign, what are the recent treatments available. To understand all these things, I am very happy. I am joined by Dr. Kalpana Sengupta, who is an experienced pediatrician with special interest in nephrology, and she has treated countless number of patients in the past. Dr. Kalpana, welcome to our channel.
Thank you.
Can you tell us something about your background again? I know you have come earlier, but for our viewers' understanding.
Sure, Doctor. First and foremost, thank you very much for giving me this opportunity. I am Dr. Kalpana Sengupta. I have been practicing in UAE since the last 22 years, prior to which I was at a big children's hospital in Bombay, wherein my special interest in pediatric nephrology took me to do further study and be interested and treat these children. So the topic is really close to my heart and really excited about this podcast.
Yeah. Thank you very much for your introduction. I am sure everyone is going to get benefited with this. So to begin with, in simple language, what is nephrotic syndrome, doctor?
So nephrotic syndrome is a disease affecting our kidneys. And in the most simple language, there is a loss of protein in the urine that is at the base of this disease.
Correct.
And that leads to so many other things.
Yeah. So as a parent, because since we are discussing about children, as a parents, how will they identify in the early stage if someone has developed something related to this disease?
Right. So the first and foremost thing that they notice is the swelling of the eyes, like the upper eyelids. That is the most common thing that they notice, and they would, if they are very observant, they would notice it more often in the early morning. When the child wakes up, if there is an early morning puffiness of eyes, that should ring some alarm bell.
Yeah. So in that case, is that the only sign which is early, or?
Yeah. So not only that, what happens is in the beginning, parents may not notice the frothiness of the urine, which is also another sign which they can pick up, because as we lose protein in the urine, our urine becomes frothy. But experienced parents, when they have been dealing with a child in the family who has nephrotic syndrome, their first clue normally is, even before the eye swelling develops, they notice the frothiness and they come back to us.
Yeah. You said protein in the urine, so that gives the frothiness or frothing of urine. So why does protein leak in the urine in this condition?
Yeah, so to understand this, we have to understand that kidneys are the filtering units of our body. So at the base of it is a network of capillaries, which are small blood vessels. So normally you can imagine it like a sieve that does not allow big particles to pass through.
Correct.
However, for one reason or the other, when this sieve network is damaged, the bigger particles, bigger molecules like proteins leak through this.
Okay.
And that's when this protein leaks into the urine and then causes the frothiness.
Yeah. But are there any specific reasons for this protein leakage?
Well, to be very honest with you, there's been a lot of research going on this since the last 30 years or more. They cannot pinpoint one particular reason for it. However, there have been a lot of subsets now that have been identified. Like we have nephrotic syndrome starting in very young children, less than 3 months, which we call congenital nephrotic syndrome. In those cases, a very, very strong genetic link is identified.
Predisposition. Yeah.
In some other children, a circulating factor is found in the blood, which affects the kidneys.
Okay.
So, as research progresses, we will know more about it.
Correct. So, in your practice or overall all over the world, how common is, like in terms of, like, say, I would say statistics for common people's understanding, how common is nephrotic syndrome in children especially?
Yeah, so it's about 3 per 100,000 to about 16 per 100,000 in various studies. So when we are talking about our practice, because the referrals come to those who are interested in nephrology or dealing with nephrology cases, it seems more.
Correct.
But in terms of a general pediatrician who's looking after children, that's about the incidence.
Correct. So coming to the symptoms, now whenever it happens first time, we always have a tendency to blame it to some food or something happened recently and that has caused this. So is it fact, like, is there anything like a trigger by food or any infections or anything which happens for the first time?
First time when they come to us, more often than not, there is no specific trigger that is there. In some children, there may be an infection. In some children, there could be a vaccine. There could be an insect bite which could have caused it, but not in the majority. So very often parents are really distressed about this because their question is, doctor, where have I gone wrong? What have I done wrong? Could I have prevented this?
Correct.
So to reassure them that it is nothing to do with them, it's not their fault. It more often than not, it is an idiopathic condition that just happens.
So it may just happen spontaneously on its own. So this is very, very important for our viewers to understand that if it is happening for the first time, don't blame it to any habit or food or anything. It may just happen spontaneously without any reason. So in such cases, then how do we diagnose in initial stages whenever something like this, swelling or whatever symptoms they come with? So how do you diagnose that this patient has, say, protein in the urine or specifically nephrotic syndrome in the urine?
So what happens clinically is very often the initial signs, symptoms are missed. And the swelling which is noticed just around the upper eyelids in the morning time progresses to involve the feet, involve the stomach area, and the child gets bloated up. So clinically we see this swelling everywhere and accumulation of water basically in the body. Once we see this, if they come to us, we have to do the gold standard is urine test to quantitate the protein loss. So we do the urine, normal urine analysis. Also we estimate how much protein is being lost. Now once we lose the protein in the urine, our blood albumin also, which is the blood protein indicator, also drops. So we look for that.
Correct.
The third factor that is there in nephrotic syndrome is the lipids in the body. They rise. So we look for the cholesterol and lipid values. So it is a combination of these 4 things: the clinical picture, the protein loss in the urine, the low proteins in the blood, and the high cholesterol in the blood, that gives us the clue that yes, this is nephrotic syndrome.
So, so basically the blood test, urine test will try to diagnose if someone has a nephrotic syndrome. So are there any advanced tests after this if it is you're not fully, like, you're not getting any clue to the root cause or diagnosis?
So that depends on the various clinical scenarios. Now the basic test that I mentioned, in any resource limited place, a pediatrician can safely diagnose nephrotic syndrome based on this.
Yeah.
And the main thing to remember is that if you don't have the criteria satisfying these basic 3 tests, you are not going to call it nephrotic syndrome per se.
Correct.
But now nephrotic children can have atypical features. When you have examined them, you may get these children's blood pressure has to be seen if the blood pressure is high. If the urine test that you did shows a lot of red blood cells, then we will go for the second line testing to see whether we are dealing with a plain, simple, idiopathic, nephrotic syndrome,
Correct.
or there is some other sinister cause.
Yeah, yeah. So in this second line testing, those are just blood test or any other tests are involved?
There are blood tests and the ultrasound of the kidney, which is done routinely, it is just a baseline test to see the structure of the kidney.
Correct.
It is not going to give us any specific clue, but that is done. But we don't need many more tests in these scenarios.
Correct.
Then depends on which part of the world you're in. So there are certain endemic diseases like, for example, in Southeast Asian countries, hepatitis B. That is very commonly associated nephropathy. So that can cause a similar picture.
Correct.
So we would look for that. We would also like to rule out certain infections like tuberculosis in those countries before we start the definitive treatment.
Correct. Now, often kidney biopsy is suggested in nephrotic syndrome. So, do all children who present to you with nephrotic syndrome, you ask them to do a kidney biopsy, or any specific situation you suggest?
Not at all. Kidney biopsy is not a routinely done test in most of the cases. It is got very, very specific indications.
Correct.
So, in case of nephrotic, now once we have got the clinical picture, we have diagnosed it on the basis of the basic test. Then when we start the treatment, then comes the characterization of what type of nephrotic we are dealing with.
Correct.
And that depends on the child's response to the treatment. We subdivide them further. So majority of cases do not need a biopsy, and the parents need not worry about that.
Yeah, so that's again very reassuring for all the parents. Because unlike adults, in children the biopsy is not advised in each and every cases. It will be advised in only specific cases. That decision will be made by, of course, you. So no need to worry about the word kidney biopsy every time. Now, whenever the nephrotic syndrome is diagnosed, the first line of treatment is, of course, steroids.
Yes.
So, is it like the must for all the cases, or because obviously it comes with lots of side effects?
Yes. So, steroids are the mainstay of treatment of nephrotic syndrome. So, one word that I would definitely tell the parents not to worry about this.
Okay.
Because the steroids are our powerful agents that will definitely help the child recover from nephrotic. The thing to remember is stick to the protocol given by the doctor, follow up regularly as advised by the doctor, so that we can minimize the side effects or we can monitor the side effects.
Correct.
That is what is most important.
Yeah.
But however, there is no reason to be scared of giving steroids. That is the first line treatment of nephrotic syndrome.
Yeah. So this is again very important for all the parents to understand that steroid is the main treatment and it cures most of the nephrotic syndrome in children. Although it is associated with lots of side effects, but those are for the short time, and maybe once the disease is cured, it should. Now, we do see relapse in children, relapsing nephrotic syndrome. So, why do some people or some children relapse with this disease? Yeah.
So, the fact to remember, like I said, after we have started the treatment, we see the response of the child to the treatment. So, based on the response, we categorize them into two broad categories. One is steroid sensitive nephrotic syndrome, and the other being steroid resistant nephrotic syndrome.
Right.
So, steroid sensitive, we are happy with those cases because this is where they respond to the steroids. But the nature of the disease is such that they will have relapses. Okay. Now, some of these relapses are triggered by infections. and which nephrotic syndrome is a common disease of school going children.
Correct.
So they go to school, they get exposed to children with other infections, they tend to catch infections faster.
Right.
Because in a way, when they are losing proteins in the urine, they are also losing some protective factors. That's the fact to remember. So these children are prone to more infections.
Correct.
So once they have an infection, that can trigger a relapse.
Yeah. So is it always infection only, or any other reasons are also there?
Well, other than infection, when they are taking high dose steroids, we don't give them things like vaccines, especially the live vaccines are not recommended. But if by chance someone has given vaccination, that may happen. If they have not taken care of their diet properly, then the disease, may go on.
One question which often I also face as an adult nephrologist whenever there is a relapse. It is stress, whether stress is triggering a relapse, emotional or whatever stress is there.
Yes.
So whether that is triggering a relapse. So how true is that in children?
Well, there have been studies that show that emotional stress can trigger a relapse. They have said that even, stress of exams or joining back schools and things like that. But to be very clear about it, in our practice, I have not noticed stress to be a major factor. These are small kids, and I've really not noticed that. Though definitely the literature describes emotional stress to be one of the triggers of relapse.
Honestly speaking, everyone is stressed to some extent nowadays. So it is very difficult to prove or disregard this factor in this condition. Yeah.
We would like our children not to be stressed at least.
But even
leave
children,
the stress to the adults.
but even children are stressed nowadays with homeworks, exams, so many things.
I agree.
Yeah. So when a treatment is started, whether it is steroids or any other medicines, how long does a typical treatment last for these patients?
Yeah. So this is very important because the treatment for the first episode of nephrotic is different from that for a relapse. And it's longer for the first episode, and this is a very important thing to remember for the parents and the doctors alike, because once the child responds, it's not as if we can just stop the medicine, which is a mistake done by a lot of them. So the first episode has to be treated. Initially we give there are various regimens, but on the whole it is either 4 weeks of daily and 4 weeks of alternate day, or 6 weeks of daily and 6 weeks of alternate day treatment.
Correct.
So this needs to be followed very thoroughly. And when you talk about the treatment for the relapse, the problem we see over there is over treatment. Some of the doctors treating these children, they go on giving high dose steroids for a longer time, thinking, okay, let me get it in control. So which is not good. Also, a lot of parents do self treatment, so we advise them against that. So once they know that the child responds to steroids, they do the home monitoring and they just go on giving it. So both the things are wrong. Not giving adequate treatment or giving excess treatment when not indicated, and not doing it under supervision.
Correct. So this is again very important point you have highlighted. The treatment is usually decided by the treating doctor, but many a times we see parents, they know most of the medicines, they know many times you start the medicine once they visit you for a relapse. So sometimes they do a self-medication, which is very risky. It is dangerous sometimes, because steroids is not without any side effects, and the dose may change. The dose which you decide at the time of relapse may be different from the dose which parents self-medicate. So please don't self-medicate, visit the doctor. Now someone who is getting this relapses again and again, or if it is not getting cured completely for some reason, what is the long-term risk for kidney in these patients?
Well, so then a child who's not responding to steroids, if it is a steroid resistant case, that percentage of cases we need to do biopsy and further investigation, and a small percentage of them go on to suffer with the kidney damage in terms of the kidney function.
Correct.
But the majority of relapsers, whom we label as steroid dependent or frequent relapsers, need not worry about it. They do have relapses, they may need the second line treatment, but they do well in the end in terms of the kidney function.
Yeah. So majority of the children do recover completely.
Absolutely.
A very small percentage may develop some
Yes,
sort of
yes.
damage, but it can, if you monitor closely, you can pick it up at early stage and
Yes.
try to correct it with the medicine. So when the treatment is started for nephrotic syndrome, what is parents' role at home, which they can supervise children, or what habits they should follow at home,
Yes.
so that the disease will be like stress free and it will recover fast?
Absolutely. So this is very important. Parents have a big role to play, because giving the medicines or devising the protocol is our job. Monitoring the child is our job. But the parents are the ones spending the time at home. They have to take care of, first and foremost, the diet of the child, because as we explained earlier, nephrotic syndrome leads to increase in the lipids or fat content. So their diet has to be very carefully monitored. We should not be giving high fatty foods. We should not be giving very salty foods, especially in the phase when the child is bloated up. And we should be giving adequate proteins to these children. So the very first visit, when we diagnose this condition, the parents are in an emotional turmoil, because the minute you say that your child has got an illness that has a chronic course, they get worried. So what my practice is to call them again very soon, maybe after 3 days, when they have had time to come to terms with the illness, and then sit and talk to them about the precautions. So first and foremost is the diet. And sometimes it's the hidden sources of salt which they don't think about. So it's not only the salt that you put in your food, the salt that is there in your chutneys and papads and in all sauces, in
biscuits,
cheese. So all these things have to be taken care of. The baked items, the breads, they have the hidden salt. So we educate them about that. Second, most important thing the children that we tell them is to maintain a nephrotic diary. So nephrotic diary is a very simple thing. They have to maintain a diary, or they can do it on Excel sheets nowadays in computers. It is the record of their child's illness from day one. The reason being that they might go to another city, doctors may change, whatever may happen. In order for us to understand the course of the illness, it's very important. So in this diary, we tell them to maintain that, okay, this date the treatment was started, and this was the dose. What happened? Was there an intercurrent infection? Did the child respond? Then what was the dose next? So this is very simple way. Some parents are very good at this. And also they understand the importance of weighing the child. So weight is a very sensitive indicator in these children. So we tell them to keep a good weighing machine at home. Nowadays, most of the people also have BP measuring devices. So in a child where I think it is necessary, I tell them, okay,
even the urine protein
as a
measuring,
step, urine monitoring, heuristics are very easy ways of monitoring urine protein loss at home. So that is also something they do, and maintain in a tabular form. So this treatment was started on this day. This was the urine protein. This happened. This was the dose. Once they maintain that, it becomes easy for them and for us.
Correct. Very valuable advice. Coming to the next very important question, which I feel consumes most of the time during discussion, and that is diet. Now, frequently parents must be asking you which food are better and which food are not, or they may make things worse. So are there any specific food which make it worse, or a food which is better for these patients?
So I wouldn't say food is better or worse. One thing to remember is that say water intake. We take water intake. When your child is bloated up, we give you a certain, we never restrict their water intake, especially say we are in a country like UAE in summer months when the requirements are high. So we give them adequate water. We tell them about low salt. That is very important, definitely when they are bloated up. So that we have already touched upon that. And then the proteins. Now this depends on whether they are vegetarians or they are non-vegetarians. But the white of an egg, that is advised to them. That's a good protein. Here, there used to be a concept earlier where a lot of people thought that since we are losing a lot of protein in the urine, we should give high protein diet. So that is not something we recommend.
Correct,
It should be adequate protein diet.
Correct.
And in some cases, we may take the help of a dietitian also if required, especially in steroid resistant cases where the kidney function starts faltering. So we have to also look at diet which doesn't affect, worsen the kidney function.
Yeah. So maybe we can hold a separate session on diet itself for kidney sometime later. Now, most of these school-going children, another worry for parents is whether he can go to school, whether he can go to classes, whether he can play sports, or whether he can get involved in other activities, extracurricular activities. So, what happens to that? What is your advice for these parents?
So, as I always tell the parents that the purpose of treating an illness is so that your child can do all age-related activities as much as possible.
Correct.
So, apart from those acute phases when the child is acutely ill, we don't restrict them from going to school or playing sports or taking part in all the school-related activities. And that really leads to boosting of these children's confidence also, because we also have to understand when they are on long-term treatment, there are certain physical changes that happen.
Correct.
Steroids make them gain weight and their facial features look different. So we need to boost their confidence in whichever way possible.
Right. That's very important thing. So in such situation, what are the red flags which they should be looking at, and they should not wait for long, they should not self-medicate and just report to you or hospital immediately?
Yeah. So in steroid, resistant cases, it's different. But on the whole, if we talk about nephrotics, two complications that are inherent part of nephrotics is one is their susceptibility to infections. One infection that is very rapidly progressing is peritonitis. What is peritonitis? It is like inflammation or infection of this covering which we have inside our abdominal cavity, which covers the organs. So once that gets infected, there is a problem. So the earliest sign is abdominal pain. If the child has severe stomach pain, please do not wait. Apart from that, the second thing that nephrotic syndrome children are prone to is hypercoagulation. By that I mean that since the water is less, the blood is thicker. This is the simplest term we can explain to the parents, and that can lead to certain complications. So if there is vomiting, if there is diarrhea, they'll get dehydrated and they will get affected in a worse way. The extreme cases of hypercoagulation, we have very severe complications like blood clotting in various parts of the body. So that happens rarely. So, but right in the beginning, these two categories they have to take care of. They have to protect their children as much as possible from infections and take care of the fluid intake of the child. And if the child is unable to take fluids orally, then definitely report to the hospital.
Correct. So apart from the routine symptoms like say swelling or frothing of urine, if you are not or if you are clueless about all other symptoms, it is better to visit the doctor immediately, because as Dr. Kalpana clearly mentioned, infection and clotting are some of the worrisome complications of this disease.
One more thing I would like to add here. That steroids are immunosuppressants. By that I mean they will suppress your child's immune response. So if the child is taking steroids on a long term and starts with fever, don't wait back. Get your child evaluated.
True. Now one more common questions you must be facing: is there any role of genetics, or is it a familial disease? Like what I mean to say is, if a parent has a nephrotic syndrome, is it likely that their children will get, or someone has developed?
Yes. So genetics in all parts of medical diseases, the field of genetics is now just exploding. And so much so that I remember the days when congenital nephrotic syndromes had, we had to do renal biopsies to prove it. but no longer. We can do a simple genetic test and find out that this is a case of congenital nephrotic syndrome. Similarly, now more and more monogenic problems are being found, genetic problems are being found. Having said that, it's not the case in all the children with nephrotics. So the majority of children day-to-day idiopathic nephrotic syndrome cases that we come across, it's not as if all of them have a genetic basis.
Background. So the majority are not having any genetic susceptibility, so no need to worry. Just follow the treatment, follow doctor's advice, and everything should be fine. So are there any newer treatments? Suppose if someone is not responding to steroids or developing some worrisome side effects of steroids for some reason, he stops steroids. So are there any alternative medicines or newer medicines available in such cases?
Yes, there are definitely newer medicines available for nephrotic children. So now in cases where they don't respond, steroid resistant, the protocols are different. Or in cases where they are responding but they get dependent on steroids, or they have frequent relapses. Now this is the subgroup that we face more often. Here our worry from a doctor's point is not to endlessly continue on steroids, because steroids will have their own side effects. So we have a second line of steroid sparing drugs, and in that there are 4 or 5 agents, and the latest one is a monoclonal antibody which is given. So now remember, this subgroup is even more advanced. We are reducing the side effects of steroids, but we can have individual side effects related to these medications. So these have to be definitely done under expert supervision with proper monitoring for side effects, and the levels of the drugs in the blood also have to be checked to fine-tune the dosage for a particular child.
So steroids are there, second line of treatment is there, newer biological agents are there. So there are many options available for treatment. So if someone is following a proper treatment, someone is recovering as per expectations, so how is the long-term outcome in those patients?
It is very good. Long-term outcome is very good in the scenario that you just described. One thing to remember is, it is at the moment science has not advanced enough for us to say right in the beginning, first episode, whether that child will have frequent relapses or no, or when he will outgrow his nephrotics. So we have seen children who don't relapse for 3 years, 4 years. We have seen other children who relapse multiple times in the same year. So on the whole, those who are responding well, generally it is said that by puberty they will outgrow their illness.
Correct. So this is again comforting for most of the parents, that if you follow a good treatment, if they respond well, then the long-term outcome is good. But if you don't follow the treatment, then it becomes really unpredictable. Sometimes in spite of best treatment, it becomes unpredictable. But if you don't follow as per doctor's advice, definitely that is something no one wants. This brings us to the end of the main questions for today's podcast. We have one more section, that is rapid fire, and are you ready for that?
Sure.
So these are short. We want a short answer for this. First symptom parents notice:
swelling around the eyes.
Most common trigger for relapse:
infections.
Key test every parent should know: urine test. Most useful home monitoring tool:
heuristics.
Correct. Steroids, friend or enemy?
Friend.
Best diet advice:
so low salt, adequate protein, adequate fluid diet.
What is, I'm sure you have come across many myths, but which is the commonest or biggest myth about nephrotic syndrome?
Biggest myth is that once my child has nephrotic, his kidneys are damaged.
So that's true.
Their questions are always about whether he'll need transplant, whether he'll need dialysis.
True. One thing parents should never ignore:
swelling around the eyes, fever in a nephrotic child.
And any message you want to give through today's discussion?
Yeah, so my message would be, though this is a chronic disease with frequent visits to the hospital and many relapses in most of the cases, but parents have to understand that we can, with proper treatment and monitoring, we can keep it under control.
Correct.
And eventually the child may outgrow it.
Yeah.
Do not do doctor shopping, and do not go for alternative medicine without thinking. And that is one thing that we see sometimes.
True. So that brings us to the end of this very detailed, insightful and clear discussion related to nephrotic syndrome. Dr. Kalpana has explained everything in very simple language, how to identify it, what tests are done, and what care parents should take at home to make sure that the child recovers in time and then there is no relapse in the future. If you have any questions or any doubts related to today's podcast, please do write it in the comments. Please do share this episode with someone who needs to understand this. Someone's near or dear one is suffering from nephrotic syndrome, so that correct information is spread in the community. And that is our purpose of this podcast, to explain the disease in simple language without any complex medical terms, so that each and every person will understand it and everyone will be benefited. If you like this episode, please do like, subscribe to the channel, share it with someone who need to know all this information. This is me, Dr. Amitabh, with Dr. Kalpana, signing off from today's episode. Do take care of your health. Remember, prevention is better than cure. Thank you.